Hello, I'm Peter Okwacha. Welcome to Focus on Africa, our top stories. Nigeria is to test the controversial drug hydroxychloroquine for coronavirus treatment despite the WHO suspending its trials. A call for vaccine volunteers as scientists working on a trial with Oxford University seek recruits in Kenya. From spraying passengers to partitions for offices and schools, how South Africans are finding innovative solutions for the new normal.
A local company has created this sanitization booth which takes your temperature before it sprays you with a water-based sanitizer. And thereafter, passengers can go into the bus.
Also on the program, coronavirus and the elderly. We'll be talking about the challenges faced by older people across the continent and those who care for them. And love in the time of lockdown. We meet a couple who've combined tradition with virtual reality to mark their special day. Thanks for joining us here on Focus on Africa from BBC World News. We've got coverage of trials of coronavirus treatment from both Nigeria and Kenya today. And we start in Nigeria, where it's been announced that it's going ahead with clinical trials of hydroxychloroquine to see if it can treat the virus. That's despite the World Health Organization already suspending such trials in several countries due to safety concerns. Ishaq Khalid reports.
The Director General of Nigeria's National Food and Drug Administration and Control, or NAFDAC, Professor Mojisola Adeye, told a Nigerian television channel that even though WHO has suspended trials, there is no data regarding how hydroxychloroquine might affect an African population. She says she doesn't dispute the suspension by WHO, but there is the need for data from Africans to be worked on in such trials. She says the genetic composition of Africans is quite different. Therefore, Nigeria is going ahead with its own trial, which began recently in Lagos State, the country's epicenter of the virus. Other states across Nigeria are likely to participate in these trials as well. She hinted that the results of this trial might take at least 3 to 4 months before they are known, whether the anti-malarial drug is actually effective against coronavirus or otherwise. Earlier this week, WHO, the World Health Organization, announced that clinical trials of hydroxychloroquine had been suspended in several countries because of safety concerns. It says the temporary suspension was a precaution following a medical study which suggested that the anti-malarial drug could actually increase the risk of coronavirus patients dying. So as the world continues to struggle to find a vaccine or cure for coronavirus, health officials have been warning people against self-medication or taking any untested remedy. Ishaq Khalid, BBC News, Abuja.
Well, in Kenya, there's also focus on a vaccine trial there as researchers are calling for volunteers to take part in the trial of a potential vaccine pioneered by Oxford University here in the UK. The Kemri Wellcome Trust, a health research group, needs 40 health workers in the city of Mombasa and a nearby town where the trial will take place. Rhoda Odiambo has more.
Globally, researchers are racing to find a vaccine for COVID-19. Very soon, Kenyan researchers will be joining their counterparts in their search. They will be trying a potential vaccine that was developed by scientists at Oxford University and already being tested in the UK. A team of 15 scientists will be taking part in this trial, where more than 40 healthcare workers will be recruited. The Kemri Wellcome Research Trust program in Kenya was chosen to take part in this trial because of the infrastructure, capacity, and the resources to take part. So far, 2 clinical trials in Kenya are awaiting regulatory approval. The other one will focus on patients who have already tested positive for COVID-19. There's been a lot of controversy on testing of vaccines in Africa, but the researchers stress that they'll get regulatory approval before any trial begins and that Kenyan participation is crucial if the vaccine is to be found suitable for use on the continent. Rodo Diambo, BBC News, Nairobi.
Let's take a quick look now at other stories making the headlines across Africa and the rest of the world. A French court has rejected a request to release Rwandan genocide suspect Felicien Kabuga under court supervision. Mr. Kabuga's lawyers had argued that the suspect be released on bail because of poor health. 84-year-old Kabuga, who can appeal the decision, is accused of financing and arming the ethnic Hutu militia that killed some 800,000 Tutsis and moderate Hutus in 1994. The United Nations says at least 38 people have been killed by an armed group in the east of the Democratic Republic of Congo. They were killed in a series of attacks by the Allied Democratic Forces in the provinces of Ituri and North Kivu. A local monitoring group says nearly 500 civilians have been killed by the ADF since the launch of an army offensive against the group in November. A UN agency report has found that more than 1 in 6 young people worldwide have stopped working since the start of the coronavirus pandemic. The International Labour Organization says the young were being hit harder than any other group, with women more likely to be affected. The agency said the pandemic was destroying jobs and creating obstacles for those seeking to enter the labour market. The head of the European Commission, Ursula von der Leyen, has set out proposals for an $800 billion package of grants and loans to rebuild the European Union's economy. 2/3 of the amount will be for grants to member states and businesses worst affected by coronavirus, with the rest in loans. As cases of COVID-19 continue to rise in South Africa, there's a realization that the virus will remain for quite some time. As a result, companies finding innovative solutions to curb the spread while also allowing people slowly get back to their lives. The BBC's Vumani Mkize has been finding out more.
It's rush hour in South Africa's largest township, and residents are making their way to work. With lockdown regulations starting to ease, there's a palpable sense of relief. They can start making a living again.
If I had to go back to normal living a month ago, I would have probably ingested corona because it wasn't normal for me to sanitize, but now it's in my system.
This is the new normal for public transport users here in Soweto. A local company has created this sanitization booth which takes your temperature before it sprays you with a water-based sanitizer. And thereafter, passengers can go and enter the bus.
However, scientists have warned that while the disinfectants do kill the virus, the sprays tend to degrade quickly, and with over 45,000 passengers using this bus service daily, the lack of social distancing is a concern for transport authorities.
We can't afford this. This is a dead zone. Once people get into these buses the way they are, and then they cram into the buses, we are just transporting the disease. That's what we are doing.
Limiting the number of people traveling is a likely solution to this problem, and innovations such as the sanitization booths provide a quick and efficient way of disinfecting large amounts of people.
Our young engineers came up with the designs, and then after the designs, it was the production. And we had to hit the ground running because COVID was there and we were closed. We needed to do something so that we catch up with the curve and try to flatten the curve as fast as we could.
Besides commuting, the world of work and education has also been fundamentally changed by this pandemic. Mr. Plastic is a Johannesburg-based company that is finding innovative solutions to help us cope with the new normal. They manufacture protective screens for open-plan offices, reception areas, and they've even created these Perspex desk dividers for schools.
We know that the schools have not officially opened, but they have got certain criteria, desanitization like we've had to do. And obviously, this is good. This is a desk. This is obviously, this one is high school. This is from grade 8. So you are completely boothed. The child sits here and does the work.
It remains to be seen if these booths will be adopted by schools. But what is certain is that to beat this pandemic, we will all have to modify our behavior and to adapt to our new normal. Vumani Mkize, BBC News, Johannesburg.
This is Focus on Africa from BBC World News with me, Peter Okwoche. Still to come, we find out how to organize a socially distant wedding with a couple who did just that recently in Nairobi. Welcome back, I'm Peter Okwoche. Now, some of the most valued and respected members of any community are the elderly, but they are also some of the most vulnerable during this pandemic. And there's growing concern that older people, especially those with non-communicable diseases, are facing challenges in accessing medical treatments and healthcare. Lockdowns and concentration of healthcare resources on COVID-19 have seen some, especially in the developing world, forgotten about and increased their vulnerability to COVID-19. Across the continent, nearly 120,000 cases of coronavirus have been recorded, with just over 3,500 deaths. Older people are most at risk as they often have weaker immune systems, which makes it harder to fight diseases and infection. According to Alzheimer's International, 4 million live with Alzheimer's in Africa, but as this is an estimate, the true figure could be higher. For more on this, let's go now to the Democratic Republic of Congo and speak to Anatole Bondu. He's the country director for the organization Help Age. Anatole, what has been your biggest challenge in dealing with the elderly during this pandemic?
Yes, thank you. During this pandemic, the big challenge was the health facilities. We have poor health facilities in DRC and lack of ventilators. There is lack of access to medical, which is made more vulnerable as older person to be more affected.
Now, with all the sudden changes in terms of social distances, the lockdown and, hygiene, how are you communicating this to those elderly ones?
The elderly one, as you know, we have a poor communication in the country regarding the strategy which has been made by the government to communicate on COVID. The all mean which Help Age is doing is just to train all people who have been in the area caring with the older person, because all the measure which the government have put in place regarding communication to the older people is on TVs, on radios, and use social medias, which are not strategy which can catch up, because most of the older people are illiteracy and they are living where there is no electricity. That's why, as Help Age, we are doing training on those who are in the community, our focal point, who may pass the message through the older people groups.
Mm. So you're obviously facing problems there. You've mentioned that what the government is doing is not really reaching those people who need it. What do you think they should be doing then, the government that is?
What the government should doing is to have a strategy on how they can use at least the communication in the local language. There is language barrier which older people cannot access. The other issue is how to communicate with them door by door as we were talking. But the means which has been put in place, most of the older people cannot be able to access.
Mm. You mentioned the fact that you have to carry out these communications door to door. We know that across the continent, the people who are faced with the responsibility of taking care of the elderly are mostly family members. So is it these people who should be targeted when you're training people with skills on how to deal with corona and the elderly?
Yes, those people who have been in caring of older people, they are the one whom we are focusing. And those are the one whom we are training, and we give them means and the measures so that they can be able to respect, like the 1.5 meters once you are talking, wearing mask and everything. It's what we are training, and it's what we are telling them to use once they are communicating with the older people.
Okay, Anatole Bandu from Help Age in the Democratic Republic of Congo. Thank you very much. Well, during this COVID-19 pandemic, another not so much talked about issue is that of people living with dementia. In Kenya, for instance, there's been a rise in numbers of families calling organizations with concern about family members. Let's bring in Elizabeth Mutunga, who is the Chief Executive Officer of Alzheimer's and Dementia Organization in Kenya. Thanks for joining us. What have you observed, especially in this field?
Thank you for having me.
Can you hear me, Elizabeth? My question is, what exactly have you observed in dealing with people living with Alzheimer's and dementia?
One of the things that we are noticing as an organization is more calls now because a lot of people are at home with their loved ones. And so many people are noticing the changes with their loved ones. And so we are getting more and more calls because dementia is not one of the issues that many people talk about. But now because of the lockdown and the cessation of travel, a lot of people are either at home with their loved ones. And so they're calling in to get help. So we're getting more people noticing changes with their loved ones.
So more calls coming into your organizations. I know you have a wide network across the whole of the continent, but how are caregivers and those families coping?
So when we talk with our contemporaries in the other African countries, like in Zimbabwe, in Tanzania and Uganda, most of the people they tell us now what they're doing, they're working more with the caregivers so that they're able to equip them, to give them information that they can give to their loved ones with dementia. Most of them may understand, some of them may not. Of course, issues of wearing a mask is not something that they are used to, hand sanitizing, social distancing, because most of the people who have dementia also are the ones who are older persons. And so the social distancing is not a language they understand. They love shaking hands, they love hugging. So it's also one of the things that we are trying to communicate to the caregiver so that they're able to give this message to their loved ones.
And for me, that's the intriguing thing, Elizabeth, because as you mentioned, these people living with Alzheimer's and dementia might not be necessarily aware of their surroundings. They might find it hard to understand what's going on. How do you get that message across to them?
We try the level best that we can. We've had instances, especially now when it is almost time for curfew, because we have curfew in Nairobi, and some of these people now want to go out for their normal walks, or they are saying they are going home because people who have dementia are always going home. And so they will leave at the time when it is time for the curfew. So that we try and sweet talk them, maybe get out albums that they can look at to calm them down, to reduce their anxiety, or just play music that they love, because we have to work with what is available to us at that particular moment. It's not possible to have a conversation that they really understand, but you can use a language that they understand, like music, like photographs, just talking about old stories, and that can calm them down. Then you can have the other conversation about how they can take care of themselves.
And while talking to our previous guest, I mentioned the fact that the care for these people living under these conditions is normally left to family members. But what exactly can governments do to help in these situations?
So one of the things that we are working and hoping that our government is also looking at is that now trying to put out information, like the government of Kenya has been putting out information in infographics that can be used by the people who have dementia. I mean, the caregivers who are caring for people with dementia. And so we are tweaking the messages so that also it is user-friendly to the people, the carers themselves. And that is a way that the government is using to bring in information. The Ministry of Health has also reached out to us to start continuing with the programs that we wanted on dementia. So yes, there's a lot of work still, but at least there are baby steps that have started. And
that's a good thing, isn't it, that these steps have been started. But if you had a message to give to, a carer for one of these people living with Alzheimer's or living with dementia, what would that be? What advice would you give in terms of caring for that loved one, for that family member?
Sorry, I did not hear that question very well. The network it was not very clear. Sorry.
I was just asking about a piece of advice that you'd give to somebody who's caring for a loved one living with dementia or Alzheimer's in this very difficult period of the pandemic.
All right. One of the things we are doing, especially with our caregivers, is having online support group meetings where we are training the caregivers on how to take care of their loved ones with diet and eating well. So using like colored plates instead of using plates with flowers on it, because they'll struggle to eat the flour on the plate instead of eating the food. So use colored plates. Also talking about healthcare, how they can work with their loved ones, a few exercise here and there, and also making sure that they follow their daily routine. People with dementia really need to follow their daily routine. So that also gives the caregiver a space to breathe when they are okay. And also just having regular contacts with their friends, both the caregiver and the person living with dementia, so that they don't feel left out and alone.
Okay.
And also training with the Ministry of Health, especially with police.
Okay, Elizabeth Mutunga from the Alzheimer's and Dementia Organization in Kenya. Thank you very much for your time. Thank you. Now, like in many parts of the world, wedding ceremonies in Kenya have been either cancelled or held under strict social distancing measures enforced by the government to avoid the spread of Covid-19. Well, next is the story of how Justice and Grace Ngare in Nairobi coped with the new normal on their wedding day.
We had 2,500 people who were supposed to attend. That is when now it was way before, just a date before our government, the Kenyan government, started now taking full measures. That was on 14th March. And on 15th March, that was this year, everything changed. We really took a lot of measures because these are measures which are set by the government. So when we got in the church, first of all, we had the thermometer gun, whereby everyone who is coming to the church, we needed to take their temperature. We had customized masks because we really wanted to stick on that number, the 15.
I would say it didn't take too much of our energy because we planned for few people. It also gave us the best time for ourselves because we had a lot of time even with our family and few friends. So I think it was a good experience. On the finances, we have saved a lot, even time on planning and maybe looking for so much, maybe even service providers, we didn't have so much stress.
So many people were eagerly waiting to come to our wedding, to dance, to enjoy with us and to celebrate with us the big day. We had a lot of guests also because we asked our friends to send us their photos, whereby now we printed the photos and we put them on the seat, such that now the church we had a virtual audience. So everyone who had sent us their photo, they were following us on their Facebook page, on my Facebook page, whereby now people are following. We are streaming live the wedding, and people are following the wedding. So the end of the day, we felt we have achieved something.
And here's wishing them all the very best. Just before we go, a quick recap of our top stories here on Focus on Africa. Nigeria is to go ahead with clinical trials of hydroxychloroquine as a potential treatment for coronavirus. The World Health Organization had already announced the suspension of such trials in several countries due to concerns. That's it on Focus on Africa for today. Don't forget that you can reach me and some of the team on social media. I'm at Okwoche. But for now, that's it. See you again very soon. Goodbye.